Hello, health champions. Cancer can feel like one of the scariest words in the English language. It feels random, it feels uncontrollable, and it feels like something that just happens to you out of nowhere. But what if that's not actually true? What if you have far more influence over your risk than you've ever been told? Today, we're going to walk through 10 warning signs of cancer, one by one. But more than that, I want you to walk away understanding what cancer actually is at a cellular level, how it slowly develops over time, and what you can realistically do, starting today, to lower your risk and strengthen your body's natural defenses. Let's start with sign number 1, persistent fatigue. Tiredness is something almost everyone deals with at some point, and it has dozens of possible causes. Poor sleep, high stress, a poor diet, dehydration, even something as simple as sitting at a desk all day without moving. So please don't panic the moment you feel a little drained. That's not the message here. But there's a difference between ordinary tiredness and fatigue that simply will not lift, no matter how much you rest. If you've been feeling drained for weeks, even months, and sleep isn't fixing it, that's the kind of fatigue worth paying closer attention to. Here's the biological reasoning behind it. When a tumor is growing in the body, it's actively competing with your healthy tissues for nutrients, oxygen, and energy. At the very same time, your immune system is working overtime, mobilizing resources to try to identify and fight back against those abnormal cells. Picture it like a quiet war happening inside your body. And wars are expensive. They consume enormous amounts of energy. That's part of why unexplained, long-lasting fatigue can sometimes be an early signal that something deeper is going on. Sign number 2, pain that simply won't go away. We all experience aches and pains from time to time, and most of the time, ordinary pain responds to movement. If your back hurts, you can usually find some position, sitting up straighter, lying on your side, stretching. That gives you at least some relief. But there's a different kind of pain that doesn't behave that way. When an abnormal growth is pressing on a nerve, an organ, or surrounding tissue, doctors sometimes call this a space-occupying lesion, and the pain it causes often doesn't respond to changing position at all. If you find yourself with chronic headaches or persistent back pain that nothing seems to relieve, that pattern is worth getting checked out by a professional. Now let's pause here and actually understand what's happening at the level of the cell, because this is the foundation for everything else we're going to talk about. A normal, healthy cell is what we'd call regulated. It knows how to grow, and critically, when to stop. It follows internal signals from the body, almost like it's listening to instructions. A cancer cell used to be a normal cell, but somewhere along the way, something changed. It lost the ability to turn off. Growth became unregulated, meaning the cell just keeps dividing and dividing without the normal stop signals working anymore. There's a second major difference too. Healthy cells specialize. Think about what happens when you cut your finger. Your body rushes in to repair the wound, and it creates very precise, organized layers of tissue, each one serving a different function. These cells start out as basic stem cells, but as they mature, they differentiate, meaning they take on very specific jobs in the body. Cancer cells don't do this. They stay primitive, undifferentiated, essentially just making endless copies of the same generic cell with no real specialized purpose. So in simple terms, healthy cells obey the body's internal order and intelligence. Cancer cells have stopped listening altogether. Sign number 3, new lumps or unusual growths. This is one that many people are already somewhat familiar with. Women are often encouraged to perform regular self-exams to check for breast lumps, and while a new lump can sometimes indicate something serious, the vast majority of the time, it turns out to be a benign growth, something like a fibroadenoma or a simple cyst. And it's worth mentioning that breast cancer isn't limited to women either. Rates in men, while still much lower, have been rising. Men should also be aware of testicular changes. Any new, irregular lump in that area is worth having checked by a doctor as well. Sign number 4. Blood in the urine. This one understandably alarms people, and for good reason. It can sometimes point toward bladder cancer, kidney cancer, or in men, prostate cancer. But far more often, the cause is something much less serious, like a kidney stone or a urinary tract infection. It can also come from minor trauma, irritation, or inflammation of the urinary tract. Inflammation of the bladder is called cystitis. Inflammation of the kidney is sometimes called glomerulonephritis, and inflammation of the prostate is called prostatitis. None of these are cancer, but any blood in the urine should still be evaluated by a doctor just to be safe. So at this point, you might be wondering, how does cancer actually develop in the first place? It all starts with a mutation, which is simply a change in your DNA sequence. And here's something that might surprise you. Your body is making roughly 1 million tiny DNA changes per cell every single day, just as part of normal operations. When you factor in cell replication, your body creates around 400 billion new cells daily to replace ones that wear out, and each new cell has to accurately copy about 6 billion base pairs of genetic information. The scale becomes almost unimaginable. With that many copies happening, perfect accuracy simply isn't realistic. On average, your body makes around 120,000 copying mistakes per cell per day, which adds up to tens of trillions of errors across your entire body daily. Thankfully, your body has multiple layers of defense against this. The first line of defense is DNA repair, specialized mechanisms that detect and fix errors before they cause problems. Interestingly, this system isn't designed to be flawless either, because a small amount of genetic variation is actually useful. It's part of how organisms adapt over time. But too many uncorrected errors would be dangerous, so the system aims for a careful balance. If DNA repair fails, the next line of defense is something called apoptosis, or programmed cell death. Essentially, if a cell turns out to be too damaged or dysfunctional to operate properly, it triggers its own destruction. Most flawed cells never even make it past this stage. If apoptosis somehow fails too, and the abnormal cell survives, your immune system becomes the next safeguard. T cells, macrophages, and other immune cells are constantly patrolling your body, searching for cells that don't look quite right and eliminating them before they can multiply. Only if all of these defenses fail, DNA repair, apoptosis, and immune surveillance, does a mutated cell get the chance to survive and potentially develop into something more serious, sometimes referred to as a precancerous state. And even then, it's still not automatically cancer. There are several more steps involved. For cancer to actually develop, scientists generally describe 2 key ingredients that need to be present. The first is an initiator, something that increases the rate and severity of mutations. This could be chemical exposure from cigarette smoke, environmental toxins, ionizing radiation from things like excessive medical imaging or occupational exposure, or even chronic hormone imbalances. But an initiator alone usually isn't enough. The second ingredient is a promoter, something that actively drives the abnormal growth forward over time. This might be a steady supply of fuel for the abnormal cells, or something that suppresses or interferes with the body's natural immune defenses. When both an initiator and a promoter are present consistently over a long period, that's when the conditions for cancer to develop become much more likely. Sign number 5. Unexplained weight loss. Studies suggest that as many as 40% of people newly diagnosed with cancer have experienced some recent unexplained weight loss. This isn't the kind of weight loss someone is intentionally trying to achieve. It tends to be rapid, unexpected, and often comes along with a noticeable loss of appetite. The body, when dealing with a disease process, often loses its normal balance and its ability to properly process and use food. In more advanced stages of cancer, this can progress into something called cachexia, a severe form of wasting that goes far beyond ordinary weight loss, and which can affect up to 80% of people with late-stage cancer. Now, earlier I mentioned that cancer needs promoters to keep growing. Let's talk about what those actually are, because understanding them gives us real practical tools for prevention. One of the most telling clues comes from how doctors actually detect certain cancers. A common imaging method called a PET scan, short for positron emission tomography, works by injecting a small amount of radioactive sugar into the bloodstream. That sugar circulates throughout the body, but here's the key part. It tends to concentrate heavily in tumors, sometimes being absorbed at rates up to 20 times higher than normal healthy cells. That's because many cancer cells rely far more heavily on sugar metabolism, specifically a process called glycolysis, rather than efficiently burning fat or using oxygen the way healthy cells typically do. This gives us a meaningful clue about diet. While sugar certainly isn't the sole cause of cancer, reducing excessive sugar and refined carbohydrate intake is widely recommended as part of a broader, health-supportive lifestyle, not as a guaranteed cure, but as one piece of a larger picture that supports your body's overall resilience. Other common promoters include chronic chemical exposure, which interferes with the body's natural detoxification and cleanup processes, and persistent infections from viruses, bacteria, or fungi, which often take advantage of an already weakened immune system rather than being the root cause themselves. And then there's chronic stress, a major but often underestimated factor. When your body is constantly in a stressed state, its resources are diverted toward managing that perceived threat, rather than toward internal healing and maintenance. Sign number 6. A persistent, low-grade fever. This typically refers to a mild fever that occurs without any obvious cold or flu, and that simply won't go away, sometimes lingering for weeks. It may not be constant, it can come and go throughout the day, but the persistence itself is the red flag. In earlier stages, this kind of fever is sometimes associated with blood-related cancers, like lymphoma or leukemia. In more advanced stages of other cancers, fever can show up for different reasons entirely. We often get the impression that cancer suddenly appears and progresses within weeks, but the reality is quite different and far more hopeful. Take pancreatic cancer, widely known as one of the more aggressive forms of cancer. Once it's diagnosed at a late stage, it can progress quickly. But here's the question that's often overlooked. When did it actually begin? Based on current research, that very first mutated cell may take around 12 years before developing into an actual detectable cancer, and potentially another 7 years or so before reaching an advanced, life-threatening stage. That means even with one of the most aggressive cancers known, there's often a window of well over a decade where the body has opportunities to intervene. On average, across different cancer types, estimates suggest the process can take anywhere from 10 to 40 years to become a serious problem. Sign number 7. Changes to the skin, particularly moles. This is one many people are already somewhat familiar with, thanks to public health campaigns. The general guideline uses the acronym ABCDE. A stands for asymmetry. If one half of a mole looks noticeably different from the other half, that's worth noting. B stands for border. If the edges look ragged, blurred, or irregular rather than smooth, pay attention. C stands for color. Uneven coloring or multiple shades within the same mole can be a warning sign. D stands for diameter. Generally, anything larger than the size of a pencil eraser deserves a closer look. And E stands for evolving. If a mole you've had for years suddenly starts changing in size, shape, or color, that change itself is the signal to get it checked. Sign number 8. Changes in bowel habits. This includes things like new or worsening diarrhea, constipation, blood visible in the stool, stool that appears unusually dark or tarry, and ongoing abdominal pain or bloating. These symptoms can sometimes point to colon cancer. If you notice bright red blood, that often suggests the source is closer to the rectum, while dark, tarry stool typically indicates bleeding higher up in the digestive tract, since the blood has had time to change color as it travels. That said, these symptoms are extremely common and, far more often than not, are caused by far less serious issues. Food intolerances, an imbalance in gut bacteria, sometimes called small intestinal bacterial overgrowth, general gut inflammation, or ulcer. Sign number 9. Difficulty swallowing, medically known as dysphagia. If swallowing has become noticeably harder, it can sometimes point to a growth somewhere along the esophagus, thyroid, vocal cords, or throat, any of which could create a physical obstruction. However, much more commonly, this symptom is linked to something far less serious, like acid reflux, also known as GERD, where stomach acid irritates the esophagus. It can also be caused by a goiter, which is a benign enlargement of the thyroid gland, often related to insufficient iodine intake, where the body essentially compensates by growing the thyroid larger. If you've made it this far, you've probably realized that cancer can be a frightening and fast-moving disease in its later stages, but you've also hopefully picked up on something more encouraging. There is usually a very long window of time, often spanning many years, where prevention is genuinely possible. The body comes equipped with multiple layers of defense, and your overall health is shaped by a combination of structural, emotional, and chemical factors, all of which influence your immune system and your body's natural balance. So what can you actually do? The first and most direct step is to stop feeding abnormal cell growth, which largely means reducing excess sugar and refined carbohydrates in your diet. This helps limit the fuel that supports unchecked cellular growth. Alongside that, reducing your exposure to harmful chemicals, whether in food, household products, or the environment, supports your liver and your body's natural detoxification processes. Improving your overall immune function ties all of this together, since better immunity strengthens your body's ability to identify and eliminate abnormal cells before they become a serious problem. Managing stress is another major piece of the puzzle. Chronic stress keeps your body's attention focused outward, dealing with perceived threats rather than inward on healing and maintenance. Simple practices like deep breathing exercises and meditation can help shift your nervous system out of that constant stress response, improving blood flow and oxygen delivery throughout your tissues. And abnormal cells generally thrive in low oxygen environments while struggling in well-oxygenated ones. Intermittent fasting and occasionally longer fasting periods can also support this process by helping regulate blood sugar, supporting immune function, and triggering autophagy, your body's natural cellular cleanup and recycling system. And finally, regular physical activity ties everything together. Exercise supports nearly every physiological process in the body, and research suggests it can even support DNA repair mechanisms while improving circulation and oxygen delivery to tissues throughout the body. You may notice that a lot of these recommendations sound familiar, almost repetitive across different health topics, and that's because the fundamentals really are that consistent. The real work isn't discovering some secret new method. It's actually understanding why these basic habits matter enough to commit to them consistently. Sign number 10. A chronic, persistent cough. This is most commonly associated with long-term smoking, and over time, it can be linked to lung cancer. Though again, this doesn't happen overnight. Long-term smokers often experience years, sometimes decades, of chronic bronchitis, as the delicate lining of the airways becomes progressively irritated and damaged. That said, the vast majority of coughs, especially short-term ones, are simply caused by ordinary respiratory infections like colds or the flu, and typically resolve within a couple of weeks. Some infections do linger longer than expected, leaving behind a persistent cough even in otherwise healthy people, so a lingering cough isn't automatically a cause for alarm, but one that persists for months, particularly in smokers, is worth having evaluated. I want to be clear, none of this is meant to minimize how serious cancer can be. But I also don't want you walking away feeling powerless. We often hear devastating stories of late-stage diagnoses, where someone is told they have only months to live, and those stories understandably create a deep sense of fear and helplessness. But when you step back and look at the bigger picture we've covered today, the reality is that most cancers take 15, 20, even more years to develop into something life-threatening. That's an enormous window of opportunity to support your structural, emotional, and chemical health, and to bring your body back into balance. It's also worth remembering that developing cancer typically isn't the result of one single mutation, but a series of mutations building on each other over a long period, with your immune system actively working against abnormal cells throughout that entire process. Your body has far more time and far more tools to fight back than the scary headlines often suggest. One more thing worth knowing: there is no form of cancer with a true 100% mortality rate. Even with some of the most aggressive diagnoses, there are documented cases of what's sometimes called spontaneous remission, people who were given a serious prognosis only to later be found cancer-free. These cases remain understudied and are often dismissed as rare exceptions, but they offer valuable insight. What did these individuals do differently? What combination of dietary, emotional, and lifestyle changes did they make? These are the kinds of questions worth exploring further. If today's video helped you understand your body just a little bit better, I think you're really going to enjoy what comes next. And if you found this valuable, consider subscribing and turning on notifications so you don't miss future videos like this one. This script is intended for general educational purposes only and is not a substitute for professional medical advice. If you're experiencing any of the symptoms discussed today, especially if they're persistent or worsening, please consult a qualified healthcare professional for proper evaluation and care. Thanks for watching, and take care of yourself.